was born 2 weeks early. He was supposed to be a 4th of July baby. He ended up being a June 25th baby. The regular checkups will go fine. One Monday, I came home from work and he was with the babysitter. She said, "Brandon wouldn't eat." She was like, something's off. We rushed him in from the ER and they gave him oxygen thinking that he had whooping cough, and we found out that wasn't it. Well, Brandon was diagnosed at 5 months with dilated cardiomyopathy.
It basically means that the heart is weakened and it dilates to try to compensate for that weakness. We actually weren't sure if he was going to be able to go home without a transplant at that time.
From 5 months until about the age of 5, we were able to treat his diagnosis with medication.
I think what they were noticing is he just couldn't do the same amount of activity without having some shortness of breath or maybe some cough.
Basically, the way the doctor put it is that he just outgrown his heart. We found out that it was time for a heart transplant.
I started keeping up with his schoolwork immediately at Nationwide Children's Hospital. There was a girl who did contact me and that she would be tutoring him.
She would drop off the curriculum and then the teacher would finish the curriculum with Brandon.
Brandon was keeping up with everything that we were doing in class.
For the hospital to go outside of just not treating the condition but treating the child, it helped him transition from I'm a patient, but also I'm a student, also I'm a kid. It was amazing. I applaud them for doing that. In the back of my mind, you know, you're counting the days and you're thinking, while that's, you know, while the time is ticking away, your child is getting sicker. Maybe I just did my good cries when he was asleep or when he was away, because I never wanted to show him that I was worried. Said, "It's time. He's getting his heart." And when she said it, I was like, "What did you say?" You know, I had to have her say it again. And
what color was it used again?
Now, Brandon is a rambunctious, fun-loving child. You can hardly keep him in the house now. His life expectancy is so much greater now that he has the new heart.
Transplant treatment is very complex and it's a lifelong care. The family knows that we're certainly here for them lifelong, and I think that's what we can offer here at Nationwide Children's.
Dr. Hoffman, he's awesome.
I also think Brandon is awesome. He's a very active child who has really got so much benefit from his transplant, and that makes us really happy.
Nationwide Children's had an important role in keeping Brandon up with his schoolwork. He was able to return to 1st grade. He was able to transition well back into the classroom.
I put no limitations on him. He can do whatever he wants. I think he earned that right. I want him to do anything that he loves that makes him happy. Not what makes mommy happy, but what makes him happy. That's my wish. They gave me something that I didn't know I was going to be able to keep, and that was my son. He's my miracle walking.